This is NDTV. And you're watching NDTV 24/7.
Hello and welcome to our special show where we take your questions on COVID-19 to the experts. We discuss the latest medical breakthroughs. We also ask our doctors what to do now that India is slowly easing restrictions and we have to get on with our lives. Joining us, Dr. Naveen Jamwal, interventional cardiologist, associate professor of cardiology at RMLIMS Lucknow. We're also being joined by Dr. Vishal Kastwar, diabetologist and consultant physician at the Shrideep Heart and Diabetes Care Center in Jabalpur. Thanks very much, both of you, for joining us this morning. Let's begin this, Dr. Kastwar, by asking you, is India ready to open up at this stage? And as we start rejoining workforces, going out of the houses more, perhaps even take small steps towards meeting family who don't live with us anymore, what are the precautions that we need to be taking?
Is that for me?
Yes, Dr. Kastwar, if you want to begin.
Yeah. Looking at the condition in India, you can see that we have undergone this lockdown for the past around 45 days.
Yes.
And these 45 days have really given a good chance to the government to prepare. They have prepared so many beds, so many hospitals have been prepared, so many kits have been purchased, and they have really prepared, I believe, for fighting this COVID. I was yesterday reading a news from Mumbai, and they said that they were even ready to now pick up around 70,000 patients of COVID by the mid-May. So I think the government is well prepared, and not only the government, we have prepared the public also. Prime Minister Modi ji has really done a lot of work, and through his guidance, the public is now prepared. They know about COVID and they are ready to fight COVID and prevent themselves from this disease.
Dr. Jamwal, however, what about specific steps as we start moving out? We are no longer, in that sense, completely isolated within our homes anymore. There are self-employed people who can now go out and work. That would mean that plumbers, electricians, domestic helps are also coming into homes again. So, are there additional precautions that you would advocate?
Yeah, definitely. I think we need to take certain precautions, especially for maids and servants that are concerned. We can have a simple questionnaire, ask the maids, servants, they've had fever or cough in the last week or so. If they are from hotspots or if they have come in contact with some COVID positive patient, then probably we need to wait, ask them to come back at 14 days. And even if we allow them inside, we have to take care that they should be wearing a mask, including the family members. And probably see to it that the vulnerables do not come in contact with these maid servants. They are best placed in some secluded place.
All right, we have a caller with us. Achint Yadav is joining us from Raipur. Achint, go ahead with your question.
Good morning, sir.
Good morning.
Can I please know in which stage we are right now? Is it community spread? And what big measures to be taken to prevent that disease, COVID-19?
All right.
As we are in lockdown for past 30 to 40 days and number of cases continuously rising but not declining. So what big measures should be taken to prevent this COVID-19?
Okay, Dr. Jamwal, would you like to take that? Why are we continuing to see cases spiking even though everyone's been shut down now for over 40 days?
Yeah, you see, probably 70% of the cases are coming from the urban agglomerations, right? So probably the virus was already moving in these communities. It may still not maybe stage 3, but there are big clusters now in these cities. So we have to take care that we contain these clusters by having red zones, hotspots, and containment zones. That is one important. But this alone cannot be done by the government. So individuals also have to play their social responsibility. Every individual has to take the basic norms of protection, that is personal hygiene and social distancing. Personal hygiene means hand hygiene, wash your hands regularly with soap and water for at least 20 seconds. Try and not touch your face, nose, eyes. Social distance of 2 meters from any and everyone. Wear a mask if you are stepping out. And respiratory hygiene, which includes cough and sneeze etiquettes. That is, sneeze in a tissue and throw it away as early as possible. And if you do not have a tissue, then use a bent elbow.
Right. Dr. Kastwar, anything you would like to add to that at this point? Because, for instance, yesterday when we saw those relaxations being eased for the first time, there were massive crowds everywhere at liquor shops. So people were clearly not keeping precautions in mind. They were jostling, they were in long queues, there was literally chaos outside some of these shops. The police had to intervene and disperse people even. So at this point, what is the message that the medical community would like to send out?
Yeah, that was a very bad happening yesterday. What is more important is that if you are opening some new shops or something in which there is likelihood of people coming in, you should start making the social distancing measures before opening the shop. If those circles had been made before opening the shop, it would have been much better. And further, it is important for the people to understand that it's only that the lockdown is being released a bit, but coronavirus is not going down, and coronavirus is likely to increase with the opening of lockdown. So, what is important to understand for the public is that you have to take precautions now. Government has done its job. Government has done a lockdown for a long period of time. Now it's the time for release. So people should understand, and people should themselves try and maintain social distancing. Not only this, they should also keep on wearing masks all the time. Hand washing is very important. And it is important to understand that an individual is not at risk. The whole family and the whole society is at risk because of the individuals. So if the individuals maintain discipline, they are likely to serve to the society much more than this way. So it has to be understood by the public, and it is through your media and other media that the people will understand.
Right. Also, Dr. Jamwal, what happens when restrictions get eased further? For instance, when, already people are coming out in larger numbers to shop. But what about when it's going to be possible to, say, dine in restaurants once again? Are there precautions? Should people even be considering that? What is your view?
So now the time has come for a new normal. The new normal is that social distancing has to be there wherever you are, whether you're in a restaurant, airport, or even a mall if they open finally. And everyone will have to wear a mask. That is important. Hand sanitizers probably become a part of your daily routine. They have to be with you. And so one has to take these precautions probably for next 6 months or a year till we have a vaccine or some good cure in form of some medication for the virus. Until that time, one has to take all the precautions possible for personal hygiene and social distancing.
All right, let's get some callers in. Jogeshwar Rao is calling us from Hyderabad. Jogeshwar, go ahead with your question.
Good morning, Ankita and respected doctors. Actually, I am a senior citizen and a regular viewer of this very useful program of NDTV. At the same time, I found that one observation is there are two beliefs among doctors. That is about predisposed conditions elders. That is, one belief is they can easily catch the infection. The other belief is they are as good as other people until they catch infection. So they should be careful. Which one is right?
All right. Dr. Kastwar, if you would like to answer that, are senior citizens actually more susceptible, I think is the question? Or is it only more severe once a senior citizen contracts COVID-19?
See, susceptibility is definitely high when the immunity is low. So our senior citizens are definitely relatively having higher susceptibility towards COVID-19. But then higher susceptibility alone is not important. What is more important is that if you get the disease, and ultimately a lot of people are going to get the disease. So if you get the disease, and if your immunity is high, let's say you are young, you're not having any other disease like diabetes, you are having a less age, then you are likely to tide over the disease very well. Probably you may remain asymptomatic or you may develop mild symptoms. If you are susceptible, if you have a low immunity, like if you are an elderly, you are having a very low age, if you have diabetes, if you have kidney disease, then if the disease gets inside you, the repercussions will be very high. You are going to fall into a lot of complications, and then the trouble will all start. And the mortality rate, as far as the current studies are highest in the elderly and those having diabetes and CKD. So that way, it has to be understood that not only the susceptibility is relatively high, but the prognosis is worse when you have already some comorbidities.
Right. And let's get another caller. Sandeep is calling us from Sonipat. Sandeep, go ahead.
Good morning, sir.
Good morning.
Sir, my question is, I would like to know what is the standard treatment nowadays doctors are practicing in the hospital. I would like to know the treatment other than the pharmacological treatment.
All right. Dr. Jamwal, would you like to answer that? What happens in more severe COVID-19 cases when the patients are hospitalized beyond just the medicines they are taking?
See, basically the treatment is symptomatic, and most of the patients fortunately recover. Almost 80-85% patients recover. Only about 10-15% percentage of the patients would need some sort of treatment. And maybe 5% will need some critical care where ventilation may be required, both non-invasive or invasive. There is no treatment for the virus as such, but we have to remember there are certain empirical treatment, experimental drugs which are being given. Some anti-malarials, antivirals. There's talk about this new drug remdesivir also, though it is still not available in India. Probably this week we are going to get it. So basically the treatment is symptomatic. We have to see that patient does not get sick. He gets some complication like cardiac, renal dysfunction, or even neurological. You have to treat according to the complication.
All right. Our next question is in fact from Ravi, I believe, who's calling us from Hyderabad, and he has a specific question on diabetes. Ravi, go ahead.
Hey, very good morning. And first of all, thanks to NDTV for organizing this session every day in the morning. It's quite enlightening. My question is to Dr. Vishal. Dr. Vishal, very good morning to you. I've been an young diabetic. My only question to you is that my job involves majority of the time is traveling and getting in touch with the customers. So therefore, my question is, even though the government might claim that many people have recovered, what are the chances of relapsing? And being a diabetic, that what precaution one must take while traveling? These are two important questions. And, in a lockdown, people like us, we don't even get to do even a bit of exercise to keep the sugar under control. In case if we can give some words of wisdom, that would be great help.
Yes, sir. So basically, there are two parts of your question. First is about relapse of the disease. So the current understanding of the disease and the WHO understanding is that there is no likelihood of a second infection. And whatever minor reports have occurred about second infections are because of all false positives or false negatives. This RT-PCR test has a small likelihood of having false positives and false negatives. That's why those reports were there. Otherwise, once you develop a disease and you are cured, the disease will not relapse. The second point is about diabetes. Diabetes is a disease that definitely reduces your immunity. And when you are traveling a lot, or you may be traveling a lot in the next few weeks or few months, then your likelihood of catching the disease will be relatively higher than the other people who are locked down inside. So if you are diabetic, in order to maintain a good immunity, first of all, you should have a good glucose level. And good glucose levels can be identified only by monitoring. So you should keep on monitoring maybe weekly or 2 weekly as advised by your diabetologist, and see that your glucose levels remain under control. And if they are not under control, then you should talk to your doctor. Secondly, you should have a good diet. You should have a good immunity, and immunity can be boosted not only with a good diet but with a good exercise. So in the diet, you require good amount of vegetables, you require good amount of fruits, minerals, vitamins. You can take daily supplements of vitamin C. You can take a weekly or a 2 weekly supplement of vitamin D that will help you boost your immunity. Zinc can also help. So zinc tablets are available in the market. You can take them. Regarding exercise is another part which is very important. Specifically, I would like to mention that diabetics are not supposed to exercise empty stomach. So if you've taken a very small amount of meal, a very small amount of breakfast, you can exercise. And you can exercise either once in the morning, that should be for 30 to 45 minutes. Exercise can involve walking. But because of some shortage of space in this lockdown period, you may not be able to walk. Then you can do yoga, you can do cycling at home, you can do chair and table exercises that are all available. There are apps available in the app store that you can use to do exercise at home. Then there is another word about post-meal exercises. Some people who are having a high post-meal glucose levels, if they are not having any cardiac or renal problems, they can do a post-meal exercise that involves walking for around 10 to 15 minutes at a rate of 100 steps per minute after every meal, after breakfast, after lunch, after dinner. In several studies, it has been found to reduce the post-meal surge in glucose also. You can do any kind of exercise, but doing an exercise 7 days in a week is important.
Right.
And taking a good diet is very important.
All right, that's a very comprehensive response, Dr. Kastwar. Thank you for that, and I hope this is useful for all those who have pre-existing diabetic condition. Raj is joining us now from Texas in the United States. Raj, go ahead with your question.
Hey, good morning, doctors, and good morning, NDTV. My question is, right now, after lockdown, there are some relaxations provided by the central government to the state governments. And a lot of state governments immediately jump on the first option is liquor opening to the people. So on the other side, you are saying that, wash your hands and all these things. So for the immunity development. But now we are opening the liquor in a bigger way. First of all, they are looking for their financial status on the government side, not on the families, middle class families and all. So financially they will be lose, and immunity wise they will lose, and it will be a lot of effect on the people. So why governments are encouraging that? Why can't they stay for some more time?
All right.
For the liquor opening.
Okay, so Dr. Jamwal, I think the question here really is asking us to weigh between financial considerations for state governments who get very high revenue from liquor sales and the health aspect of it. Is it really good for liquor shops to be open and for liquor to be easily available for people at this time? Is it contraindicated in COVID-19? And also, of course, the larger aspect of just too much crowding, as we saw yesterday at liquor shops as they opened across the country.
So as a medical professional, I would say that keeping aside the political aspect and the financial aspect, probably the coffers of state governments and the government are down, so they have to take some measure, because if the economy completely goes down, then the use of saving lives will not make any purpose. So that, keeping that aside, I think definitely this is an issue. If you are opening up liquor shops, you have to be strict. Probably they need to be manned better by the policemen. Social distancing has to be managed. And as far as taking alcohol, liquor is concerned, I think that will not help in this situation, because probably it will decrease your immunity and make you more vulnerable to catch the infection and probably get more worse disease if you catch the infection. So why should they be open? I think that is something what the government has to answer.
Right. Dr. Kastwar, anything you would like to add to that?
Yeah, I think liquor shops are in public demand also. So that's why probably the government is opening. Economy is definitely another thing that government is thinking about.
Right.
But yes, social distancing measures should have been started before opening the shop. And now they have around 12 hours overnight. They have developed an understanding of how to develop social distancing in those shops. So the government should implement today itself, and it should be done.
All right. Thanks very much indeed for that and for joining us this morning, Dr. Kastwar and Dr. Jamwal, and answering all these questions. To our viewers, do stay tuned, and we'll continue to take your questions to medical experts. Thanks for watching.